I mean, can we mention a brief summary of how to approach potty training or toilet training as well? And then we will discuss some of the pathologies.
Yes. Toilet training, again, is one of the very important aspects that we look into independency for a child as well, and hygiene also. The time frame can vary, but generally it is between 18 months to 3 years. That is the range we would say at which it's quite good for understanding toilet training. Although for each child, it could vary. One of the most important key factors when parents ask us is to go by the readiness of the child. So we say once your child is ready is when we want you to start, and not looking at a particular age that, okay, my child is 2 years, maybe let me start toilet training, or 18 months, let me start. Now, what are some of the important cues that as a parent we should look for is the readiness of towards the readiness of toilet training for a child is one. Does your child start recognizing the being uncomfortable when the diapers are full, and they want to remove, or they're starting to come to you, try to indicate through physical prompts or requests, pulling you or trying to ask you for a change? When they start showing interest towards the toilet seat, towards the potty, when they're able to follow simple instructions, for example, you're going to say, go sit down there or go do this. And with some minimal help or supervision, if they're able to pull down their pants, all these are subtle cues which help us understand the child has some interoception. They understand the awareness, they understand how to communicate and take commands, and possibly is the right time for us to start looking into training the child, because by then even the bladder capacity is fairly established for the child. So these are some of the important cues which parents can recognize, and they can start. And sometimes we do see that they recognize these cues, but the child has not moved forward after a couple of attempts or a couple of weeks. We tell them it's okay. Possibly your child is not ready. Give them some more time, and then we restart the process again to train them within that time
Do you
period.
have any particular framework like use of potty versus toilet seat and so on?
We usually say it again differs child to child. For some children, they are more comfortable using the toilet seat. Well, for a lot of children, we do see they feel very uncomfortable with their legs being not rested. So we either say, okay, get a stool, or if they want to have a potty place, which is a lot more comfortable for the child, then that is important. But one very important thing we always tell them is to establish the consistency between, even if it's like a potty place that they're using, it has to be in the washroom. So that way they understand the connection, and they're able to establish that once they become independent as well.
It becomes easier if you have a sibling as well, isn't it? Older sibling who does it, and not to put pressure on the child. I mean, it can lead to constipation or emotional stress as well. So allow the child, and in olden days or even now in some families, the grandparents try to condition the child like early on, like 8, 9 months. So the conditioning may work, but it's not going to stay the moment you stop that process. So it's not learning. So you don't really gain much, and obviously the parents have to decide how they want to approach it. And I personally don't think conditioning is going to benefit you in any way. Allow the child to learn, and that will be a more permanent and less stressful process.
Yes, and
So
positive reinforcement also.
yeah, I
Most
think
parents tend to forget, but it's very, very important that you reinforce the child. A small achievement. It
and
could be the
positive.
child dragging you
Right.
to the washroom, or child wanting to flush or do anything. It should be rewarded that they are doing it in the right way, which gives them a lot more motivation to make this more consistent in their
It
habit.
applies a lot to discipline as well. Positive reinforcement, praising whenever they do things right, and not to negatively, I mean, say anything. Just ignore their negative behavior, and they will fade out. I mean, so positive words make a big difference, and don't scold them. Don't lose your own self-control, and so on. So